Hi, my name is Rachel Glenn and I'm a member of Group A. I will be talking about the contribution of barcoded medication administration technologies on nursing practice and patient outcomes. I'd like to start with a quote from the text that I thought was particularly applicable to this project and probably to all of our group projects. It can be found on page 125 and it reads, "Technology that is used to enhance health and delivery systems should be designed to make it easy to do the right thing and hard to do the wrong thing." I think this quote captures the very essence of BCMA technologies. BCMA makes it easy to administer medication safely and hard not to administer medication safely. So moving on to the impact of BCMA on nursing practice, BCMA has radically transformed the actual process of medication administration. Let's face it, we went from using a pen and a printed EMR, a pen and paper, to a computerized system where we have a handheld computerized scanning device, and we use that device to scan the barcode on a patient's identification bracelet to ensure the 5 rights of medication administration. That is, right patient, right drug, right route, right time, and right dose. So BCMA has also impacted nursing practice, and that is decreased the amount of time required to administer medications. It should be noted that initially, as with the implementation of any new technology, the amount of time required to administer medications at first increases due to the learning curve imposed by new technology, but over time and with proper training, the time required to administer medications with BCMA actually decreases. Now let's face it, nursing is a busy profession, time is of the essence, and so where we can save time in the medication administration process, we can use that time for other nursing care activities like conversing with patients and sitting with anxious family members and so on and so forth. So moving on to the impact of BCMA on patient outcomes. The implementation of barcoded medication administration technologies has been shown to reduce medication errors by between 50 and 85%, thereby improving patient outcomes. The definition of a medication error is any preventable event that may cause or lead to inappropriate medication use or patient harm. And for the purposes of this project, we'll be talking about medication errors that occur at the point of administration. Administration errors account for approximately 1/3 of all medication errors, and nurses are usually the ones administering meds. Examples of medication errors include wrong patient, wrong dose, wrong time, wrong administration technique, errors of omission, where the nurse neglects to give the ordered medication altogether, and so on and so forth. So there are 5 big consequences of medication errors. The first is increased morbidity. Morbidity is defined as the state of being unhealthful. I'd like to point out the example of Dennis Quaid's twins. They were administered more than 1,000 times the ordered dose of heparin because the nurse prepared the heparin from a 10,000 unit per milliliter vial as opposed to a 10 unit per milliliter vial. Due to this event, it took 41 hours to stabilize the twins and manage their anticoagulation issues. I read one report where the twins just continuously bled from their umbilical site. So a second consequence of medication errors is elongated hospital stays. Obviously, the degree to which a hospital stay is elongated has to do with the severity of the medication error. In the case of Dennis Quaid's twins, they actually spent an extra 12 days in the hospital. A third consequence of medication errors is increased costs. Estimates vary, but preventable medication errors cost the U.S. annually upwards of $21 billion. And the cost of preventable medication errors to inpatients is somewhere around $16.4 billion. So no matter what number you choose, because estimates vary, one thing is for sure, the cost to remedy preventable medication errors is high. So there's a huge financial incentive to reduce medication errors. The fourth consequence of medication errors is adverse drug events. An adverse drug event is any injury caused by a drug. Up to 7,000 deaths each year are due to adverse drug events from preventable medication errors, and more than 30% of preventable adverse drug events take place at the point of administration. I'd like to make note of 3 adverse drug events that are common. The first is hemorrhagic events due to the improper administration of anticoagulants. The second is somnolence or respiratory depression due to the improper administration of opiates. And the third is hypoglycemic events due to the improper administration of insulins. And the fifth and final consequence of medication errors that I'd like to talk about is actually death or increased mortality. I'd like to point out the story of Jasmine Gant. Jasmine was a 16-year-old that presented to a hospital in July of 2006 for a scheduled cesarean section. She was full term, had had a healthy pregnancy, and her bedside nurse administered an epidural anesthetic, bupivacaine, through her IV instead of the ordered penicillin. The penicillin had been ordered to treat Jasmine's staph infection. Jasmine actually went into immediate cardiac arrest and did not survive the event, though her unborn child thankfully did. It was later found out that the bedside nurse failed to even put a patient identification bracelet on Jasmine, nor did she use the Bcma technologies the hospital had in place for safe medication administration. So how does Bcma serve to reduce medication administration errors? It does so through automated warnings and error messages when there is any disparity in any of the 5 rights of medication administration. And just as a reminder, the 5 rights of medication administration are right patient, right drug, right dose, right time, and right route. So if you refer back to my PowerPoint, you'll see little screenshots of many of the warnings and error messages that we see on a day-to-day basis. So there's a plethora of research out there that touts the effectiveness of barcoded medication administration technologies and their ability to reduce medication errors and improve patient safety. One such study is a 2005 study that was performed in a 175-bed community hospital in Wisconsin, and it found that post-implementation of Bcma, the overall rate of medication errors reduced by 82%. And again, this study was performed in 2005. It's been 8 years since then, and Bcma technologies have improved significantly since. So one can only hypothesize that 82% is even higher now. A second study was performed in 2009 across the VA hospital systems, and it found that the overall number of errors decreased with the implementation of Bcma for all types of errors at the point of administration. And it found that the most significant decrease in medication errors was seen with errors of omission. So that essentially says that these handheld Bcma devices were effective in reminding nurses, hey, you forgot a med and you need to give it. A third study I'd like to point out was published in the New England Journal of Medicine. It was in 2005, and it looked at the incidence of medication administration errors with and without Bcma. So observers noted 776 non-timing errors in medication administration on units pre-Bcma and 495 errors on units that did use Bcma. So this is a 41.4% relative reduction in errors. The same study reported a 27.3% reduction in timing errors. And again, this study was performed in 2005. It is now 2013, 8 years later. Bcma technology has improved significantly over that 8 years. So one can speculate that percentage of reduction in medication errors has improved significantly since then. So I think that about wraps things up, and I appreciate your time.